Hi, my name is Melody Hartzler. I am the founder and CEO of PharmToTable LLC. And part of my passion for addressing the root causes of chronic disease, I've developed a team of healthcare providers, mainly pharmacists, that are working together across the country for this mission. So I'd like to take some time today to go through with you what PharmToTable team is and how you can be a part of what we're doing. So a little bit about what we're going to talk about today. We are going to talk about my journey to becoming a functional medicine pharmacist. We're also going to talk about the challenges with the current healthcare system and how we can solve the problem by using this platform with PharmToTable team and Azoba. I'm also going to talk about my vision for the future and also how you can be a part of that vision. So a little bit about me as a functional medicine pharmacist. My journey really started through my own health journey, like many of you. Many pharmacists I talk to, that found functional medicine have, very similar stories. So it's been exciting as functional medicine has been growing through the field of pharmacy to really be able to share those stories and learn from each other. But mine started after the birth of my first child, my daughter, and that was in 2014. So it's been almost, 6.5 years ago. And we've, really learned so much. I've learned so much about my gut. I had, trouble with SIBO. It took a year to even figure that out. Every door I went through in the healthcare system was like, you're fine. You don't have any, your CT looks good. We don't have any labs that are out of whack. But yet you're having daily abdominal pain and, bloating and discomfort. And so, I just kept walking and I kept looking for providers that were going to give me answers to why that was occurring that had never occurred before I had her. I also had through her birth was actually a little bit traumatic. And I really feel like that was the hammer that, hit the nail on the head as far as like what set off, a lot of my symptoms. I probably didn't have, looking back now at that functional medicine matrix and timeline, there was a lot of things over my life that set me up for, having poor gut health that could have led to that, if pregnancy or something, or that trauma experience had exacerbated that. So over time, I learned how to fix my gut. I also learned about, leaky gut or intestinal permeability and how that influenced my daughter's allergies and even in her and her eczema, and fixing that as she was a child by, sometimes taking away foods, but really correcting the gut health and working on that and helping her to thrive as a child. And so we've learned so much over this last 6.5 years. And I feel like I've, gotten to the point where I've been practicing that over the last 4 years in a clinical practice. So I actually spend 2.5 days a week in a family medicine office and work for a physician here in the Dayton, Ohio area. And through that practice, it's been a huge growth for me as a practitioner because I really do function like a mid-level practitioner, and through collaborative practice agreements, I'm able to order a lot of this functional medicine testing on my own and evaluate patients. And I really try to bring together the primary care and the functional medicine world, because really we should be addressing all chronic disease with a functional medicine approach. But unfortunately, our healthcare system is not set up to do that. We don't have hours to spend with patients to dig into their history and all of their symptoms on a typical basis, as a physician in the 15-minute medical model. And that's honestly why a lot of physicians are getting out of that 15-minute medical model, is that they're realizing to really help people, which is what they went to medical school for, that they need to change the model on their own. So some are moving to concierge practices, some are moving to monthly payment models in their practices to be able to actually spend time with people. So I don't necessarily think that it's a pharmacist could provide this differently than a physician. Then we obviously have a different angle as far as we're not diagnosticians, we're not diagnosing disease. We're just sort of helping uncover what could be contributing to the symptoms that a patient's experiencing, because most likely if they would have needed a diagnosis, they would have already received that, right? If the mainstream medical community would have felt a diagnosis was they met the criteria for that. So we're sort of getting them at the point where, they've been through that, they've not achieved a diagnosis, or maybe the diagnosis they have is just a diagnosis that describes their symptoms, like fibromyalgia, or if they're having, constipation or IBS type symptoms, it's just that Rome criteria for, okay, you meet the criteria to say that you have IBS, but they're, they really just need help digging deeper. And so that's where as pharmacists, I really feel like we can play a role into those, scenarios, IBS is huge in primary care. It's also, the diabetes connection to the gut. There's so much literature growing on a daily basis about the microbiome and how that influences the signaling and of even GLP-1 and lots of those incretin hormones that we think about. And so there's really, part of our gut can actually sort of function like an endocrine organ, which is crazy. And so just learning all of that, and putting that into practice has been just, an awesome adventure for me. And so my dream as far as, what PharmToTable could be is really a team of providers all doing this together. So many people ask me, on a weekly basis, before I started this, like, how do I practice as a functional medicine pharmacist? There's not jobs for functional medicine pharmacists. And really, there's not. And so what that means is that you would have to, start your own business, and not everybody wants to start their own business. And not everyone has time to start their own business, or maybe not even desire, to do so. And so that's really where I, wanted this team to come into play as a place where people could find a pharmacist that was, passionate about functional medicine in a central place, and be able to serve patients across the country, and be able to do that with a community of other providers. So like I mentioned there's no, no one's hiring for functional medicine. It means starting a new business, managing, a new business while you're doing your day job. So in my case, I do still practice face-to-face with patients, and I love that. And I'm not sure, how soon that I'll want to give that up. It depends on how fast we grow as a company. But I think that some people, have to do a 40-hour-a-week day job. And if I was doing that, I certainly wouldn't be able to manage another business as well. And so the startup cost with businesses, there's legal fees, there's insurance, fees on a business, in addition to liability insurance. There's, website cost, business coaching sometimes costs money if you really don't know where to start and you want to hire someone to help you. The EHR costs money, the telehealth platform, if it's not built into your EHR, can cost additional money. And there's, lots of people have asked me about training programs and where do I start with training and which one is the best. And so hopefully, as a team, we can help you navigate those different pieces of the puzzle so that you don't have to, spend all these out-of-pocket costs up front to really get started. We just want to help people get started, help them start seeing patients, because you as a pharmacist have the toolkit that you need to be able to start seeing patients for, with a functional medicine approach. You don't have to have completed a huge training program to be able to do that. You have to have some training and you have to have background. You just can't walk out of pharmacy school and, sit down and say, okay, I'm going to see patients for functional medicine and go. There has to be some kind of training involved, but it doesn't necessarily have to be a $20,000 program, whether it's a master's or all, other things. And so that's part of the reason why I created functionalmedicinece.com, was to bring that training to a more affordable place for a lot of pharmacists. And so that's actually one of the pieces that's included for our team. So we'll talk about that a little bit at the end. And so the other, challenge to practicing functional medicine is really the lack of connectivity to patient records and the patient's care team. And so we'll talk some about how Azova can help solve that problem, and the ability to order labs. I would say this is the number one frustration for pharmacists trying to get into functional medicine or functional, pharmacy, however you want to term it, practice, is that there's a lot of roadblocks to ordering labs. And as we've set up our accounts throughout the last several months with the different lab companies, we've also experienced some of those roadblocks, but we are actually partnering with physicians, nurse practitioners, PAs in the various states across the country to order these labs on the back end for us with Azova. And so that really cuts down, once I say, okay, I've got a physician and nurse practitioner, I'm able to get those folks signed up. And as they place the orders for us, we get those labs ordered for patients. So it really helps to streamline it, also helps with our scope of practice, which I'll also talk about a little bit later. And then, the other pushback is the other healthcare providers and lack of support. And so we really want, again, to create that community that is a supportive community. Many of us have worked with directly, with physicians, and can help sort of help the conversations. I've had experience with physicians that may not be as well versed in functional medicine, or maybe resistant to functional medicine, not understanding exactly what it is. Sometimes we use a lot of terminology in the functional medicine community that maybe isn't used in the Western medicine traditional practice community. And so we have to, make sure we're talking the same way as them. And we also have to, work on good communication. And so that's, again, why working as a team, we want to bounce ideas off of people on how we communicate with other healthcare providers is really important. And so Azova really helps with that connectivity and that digital healthcare system. And so the patient is really the center of that. And so when you think about HIPAA and why, this hospital system can't talk to this hospital system, or the VA system can't even talk to the other VISNs in the VA, it all comes down to patient privacy. But if your patient is at the center of those decisions, if they're the ones adding these providers to, or their records to the chart, then, it becomes their decision. They're the ones sharing that information. And so basically the patient can, connect all the dots here for us, and create, a digital health record that has, a lot of information there for you to see. So Azova can be your only digital health EHR, which is what it is for us, or some providers choose to use it as a digital layer on top of their existing EHR so that they can use it for the video capabilities, that connectivity capabilities. So we really want to, get our providers on board, get them, even if they're just on there, if you're you have a good relationship with, Dr. Jones, that's a family medicine physician in your community, Dr. Jones can create an account so you can share records back and forth easily. He doesn't have to use Azova as his primary EHR, even as an overlay in his office, but he could be on there communicating with you about those patients, and it makes it a lot easier for that continuity of care between the patients. So the lab, systems, they're really working on integrating more of those lab functionalities, but there's, an awesome app too, which I'll talk about as well. So you can connect, physicians, mid-level providers, community pharmacies, laboratory and imaging centers, wellness providers, behavioral health, all of these types of providers can be in the Azova network. And so this is what our, marketplace looks like when you search for a particular provider. And so, we have the ability to search by different states. And so we practice where our pharmacists use the license that they have in their state. And so we're looking for pharmacists in all of the 50 states to be able to service the country. We have some pharmacists that are dually licensed, so they would pop up in the search engine for multiple states. But, this is really where our pharmacists can have their information. Even if you're in the marketplace and not on our team, which we'll talk about at the end, you would be here in this marketplace link. But this is where, clinical programs can be listed. You can have visits in office. You can have them, in a pharmacy location. You can determine if they're just video options or secure messaging type visits. Some facilities might use this for in-home visits. We're not doing that at this time, but, maybe the future would bring that so that it has that capability. So Azova is also an intuitive, easy to use patient hub for all healthcare services. Again, they build their personal health record as they access healthcare services. And then again, providers can use this as an overlay. And it also has the ability for us to create an e-consult marketplace for peer-to-peer consultation. So I'm super excited that that's coming. As of right now, October 2020, we do not have that in place, but it is on the horizon. And so we're super excited about what that means for engaging our experts in our functional medicine community to be able to provide consults to the other pharmacists that are in the marketplace. And facilities also can list, their services. Patients pay online before they even book the appointment, so there's no issues with collecting, additional money from them. Providers can send orders to connected facilities, and patients can communicate about their clinical encounters with the providers, which the communication piece has been so easy. Coming from a very much more traditional EHR in the office setting to this, it's so much easier just to pop open that message. I, send a message to a patient, which they basically get as a text message. They get a link in their text message that opens up the app, and then they see my message and they can respond, and sort of the same thing back and forth. So I don't have to go out to a different place to log in. It's all, right on my phone, which is super helpful when patients are like, hey, I need to know if I should fast for these labs, or, Genova called me and said, this is XYZ with my kit. Should I do this? It doesn't necessarily have to be something I have to spend a lot of time to answer on. So I can quickly open up that, it pulls up the app. I, communicate in that messaging thread, and I'm done with that. I don't have to, come back to it. And so all connected facilities can also communicate and share records with each other, which is really helpful as well. So they schedule consent. We have built-in consent forms and templates. We also have office policy sections we upload, and we also have laboratory, imaging, pharmacy orders that are available there, and clinical documentation and collaboration. So we'll show you a little bit about our clinical documentation And this was the app I was talking about. So you can actually do the video call through the app. And then you can, share photos back and forth. So, maybe more important for, diagnostic folks like physicians, NPs, PAs that are looking, at someone's skin or rash on a telehealth visit, but still, might be helpful if something happens, a reaction to a supplement, someone wants to take a picture and show you something. And then again, this HIPAA secure messaging piece, that's really helpful for the after visit, and also show you, a little bit with what that looks like, even communicating your assessment and plan. And then step one, again, this is if, someone wants to book an appointment, they can click on, what they can even say what kind of part of the body is, a problem for them. Again, the assessment and plan piece can happen right here for you as the provider. Obviously ours are a little bit more detailed in functional medicine. Then here is just an example of, a physician's plan from a dermatologist standpoint. The system was actually created by a female dermatologist. That's the owner and CEO. And then this here again shows sort of that thread of communication for what was happening between the provider and the patient. So that's what it looks like there on the app. These are what our links look like. So when our providers have visits with patient or have their links, so they can share, out to, on their website, they can link it on our website. Each of our team members is highlighted with a bio, and also with their new patient appointment links. And so that's where this comes up. And so it based on how or what you turn on as your types of visits are offered. There's several types of visits in the marketplace, and you just decide which visits you want to turn on and turn off. And so if, someone had the new patient functional medicine visit turned on, the diabetes consultation and the med optimization, they can turn those on. And then when someone hovers over this on the website, it would give them the description of the different types of visits. They click book, the scheduling system pops up, and they're able to schedule with the provider. You can also choose to turn scheduling off if you have other systems. So say you're going to stay using like a different, the scheduling function is evolving in here. And so some people prefer to have something that's connected with their Google Calendar. And so you can turn that off and send an auto response saying, hey, thanks for booking with me. Here's my availability. And then they can go on and select that time later. So there's different options, but eventually the AZOVA will have some integrations as well with the calendars. And for providers that aren't pharmacists that would want to take insurance on our platform, so if you're listening and you're an NP or you're a dietitian or someone that can bill insurance, you can collect insurance, and you can turn that on for those appointment types, and then it would collect the insurance card. There's currently not included in this marketplace a billing software, but there is a billing software that sort of connects that we can hook you up with if you don't already have a current billing software, if you are one of those type of providers. And so with each of our appointments that we've built intake forms. And so those are already taken care of. One, the new patient functional medicine one is our most extensive. We also have, MSQ built in and some standardized surveys, because one of my dreams is that we would be able to take what we're doing here and showcase this in the field of pharmacy, but also in the field of functional medicine, and what pharmacists can do for the patients. And so basically, if we have those MSQs at baseline, and at their next visit, we can go back retrospectively someday when we have data, we can show insurance companies like, look, we can help your patients get better and thrive. And so we really want to use standardized surveys to be able to collect that information. And so I just think, the more people we get using these and doing this, we're just going to have so much information to be able to, continue to push forward for not only for the profession, but also for, creating new opportunities for us. So those are built in. The patient fills those. They get an email to fill those out after they've booked the appointment. We can also send additional surveys. So if they book for, medication optimization visit, which we didn't want to have a ton of different visit options to be able to link like every disease state with a survey. So eventually we'll be able to sort of trigger automatically some additional disease state surveys depending on what they filled out on that first survey. They're still working on that capability, but for right now we can deploy, a heart failure survey or a specific hypertension or hyperlipidemia survey or asthma survey if they choose one of those appointment types as well. So smoking cessation or anything you want to focus your practice on. Maybe there's a need with a community pharmacy in your area, or maybe there's a need with a physician's office that really needs someone to help with those smoking cessation patients, you could talk into them about that service, create that relationship, and then, do that alongside, working with the functional medicine. So there's lots of options, but really primary care is one of those low-hanging fruit for pharmacists to be involved with because they have such a need for, med optimization. And so I think having this on the platform in addition to the functional medicine is going to be really helpful for getting our pharmacist started. And then I mentioned solving the problem of ordering labs. And so if, you've had that question that, okay, I'm a pharmacist, I'm trying to sign up for Genome, I can't do that because I don't have a physician relationship, or, whatever company that is, that's always been a roadblock. Or even you just want a CBC or, an A1C, or you want a fasting insulin, and the patient's provider is like, no, we don't order fasting insulin. So they're not willing to do that. And so that becomes challenging for how you, evaluate your patients. And so in here, we have our lab ordering process is evolving. Currently, we have it set up as sort of like a intake form that we send to a physician, and the physician or nurse practitioner, whoever the provider is, reviews that. The form also includes, the patient's medical history pops in from their intake form. It includes their, medications that they're taking. It includes a section for us to write any like current symptoms and maybe suggest ICD-10 codes. We're not actually tagging the patient's insurance with any ICD-10 codes ourselves. We're suggesting based on their medical history and their symptoms, maybe ones that the physician might be able to use for the lab ordering. And so far that's been working really well. We've been, been able to do that smoothly. So we have, standard panels set up like you can see here. We also are now connected to Genova, Diagnostic Solutions, Dutch, almost with doctors' data, and we're working on ZRT and some other laboratories. And our really reason for wanting to do this is that, yes, there are, things out there that allow patients to maybe even order some of these things on their own, but they cost the patient almost twice as much sometimes to do that. And they're not able to use their insurance. And so we know that, functional medicine can be expensive. We want to offer a service that, not only pays our pharmacist, so that they can, do this type of comprehensive care in a way that still is, makes sense for them from a budgetary standpoint and from a business standpoint, but we also want the patient to be able to, have some savings. And so this part, they do pay an additional fee for lab ordering, but they save, sometimes hundreds of dollars on actually being able to bill their insurance for their labs. And so that's where, this really came aboard because, I don't want patients to have to pay out of pocket for every lab that we're recommending. So right now we can explore the technology a bit. And so I'm going to walk you over to our chart here. And so this is what our chart looks like. And so you can see we have that messaging field right here. We have the schedule that the patient, you can see the patient's schedule, and then it always comes into your appointments. You'll see right on that day, the appointments. You can click this box, change that to a different day if you're looking for appointment, maybe you did last week to finish a documentation. So we'll have, if the patient put in their picture, we'll have their picture and their name here. It will have the provider's name that they've booked with, and then it will say the type of visit it is. So I booked myself this morning with my test patient for the functional medicine new patient appointment. And then it also, the patient, I as myself did not go in and fill out that intake form yet, but I can still go into the chart and see, the patient's encounter history. And so you can see that I've sent the MSQ to this patient before. I've sent the global health scale and one of the promise scores that we're looking at, and the past function, past visits here. So I can toggle back and forth between those encounters. If I wanted to start this visit with the patient, I just have a button right here that says I can video conference with a patient. I can also click a schedule follow-up. So I can, have that quick, okay, we're going to continue this conversation and we're going to book another appointment for that. We can go in and reschedule this appointment if someone messaged us and said, I'm sorry, my internet's not working, or there's some reason that I can't do this today. And it has the patient's name and date of birth, their address, and then also over here, how much they paid. So I didn't pay for my own appointment here. So you can see that I took the whole thing off, but it would tell you if a patient used a coupon or, and you can set up those coupons. We have a few that apply to the whole business. One is for our new patients. It's $25 off if they go to our orientation class first. But if, otherwise the coupons are really up to the individual providers. And so that is where you would see that part. And then when they scheduled it. So this is what, I'm sorry, when they scheduled it for. And so our intake form then here has, all of the main reasons for visits and then other section. And then there's sort of widgets here. So drug allergies, their primary care provider, stays in there. So since I filled this out before as an example, it gives that information, carries through to the next visit. And so the same thing with, any family history, past medical history, this box here would carry through to any other visit. And then also down, there should be a medication, a record section, so they can upload clinical notes from other providers here. And then they can also add their medication list in here. So this would stay in there. And sometimes I feel like patients in functional medicine are a little less likely to put out their whole list. And so you can update all of this as you're going through the appointment with the patient. So we do add those in. Sometimes I think that I might not want to know that or need to know that, but obviously as pharmacists, we really want to know, all the medications you're on, especially if we're looking at medication nutrient depletions. So that list stays in there. It's super easy to pop things on and off. And then as far as continuing forward, the patient would see that already in there as they're completing the intake form for the next visit, and they can adjust that as things have changed. Same thing with the over-the-counter supplements. So that will stay, in each visit, and they can update that as well. And so we have environmental history as well in there, and exercise history, psychosocial history, all of these things that are really important to that functional medicine conversation. Sleep, they have in their intake form. Their readiness assessment's really important. And then the MSQ I find to be one of the most helpful tools because it looks at, the different pieces of this, gives us sort of the scores for the different symptom groups and helps us know, where we need to focus. And so here at the bottom, we actually have a provider's note section that the patient can't see. So the patient would never see that box, but this is where I put all my extra HPI in there. So the patient's talking to me about, if I'm asking more detailed questions about their diet and things like that, I'll type those in there. Or if they tell me additional things that were on the survey, I'll put that in there. And then this assessment and plan is a really cool area. So this part is what the patient actually does see. So they will see your assessment, they will see your plan. And then as you type that in, so if I, just drop in one of my macros that I've saved, which is actually doesn't look like I've saved an assessment one, but if I want to say the patient has SIBO and I want to give them our digestive food guide, and I want to talk to them about an elimination diet, or maybe I talk to them about low FODMAP. I'm going to put some lots more detail in here. I would show you past ones, but for HIPAA and the purposes of posting this video, I'm not going to do that. But once you do that, you can also have this internal note section. So there's something you want to remember for next time that is not something the patient needs to know. You can also put that in the internal notes section. But once you've done that, you can click Make Diagnosis and Treatment Plan Available messaging thread and click Update. And then the assessment and plan then would just be quickly sent to them in a secure message here. And so when they get this on their phone, they can click View Chart. And actually, I just got that text message from myself. And so when I click View Chart, it's going to pop open the app, and then I'll be able to see it right in the app here on the phone. And so the patients can access, because in order to, make a plan effective, the patient has to, be able to access that plan easily, be able to look back at things, save things quickly. So if you're sending, handouts and things like that, they need to be able to access them. So for them to be able to quickly have that on their phone is really helpful. And so after, our visits are completed, sometimes, we might leave those pending until the lab ordering situation is taken care of, but we can select that that's completed and take out the pending status and then update that. And then the visit is gone to a completed status instead of one that still needs to be worked on. And so the other piece of this I was just going to show real quick is that with that MSQ, this is sort of what this survey looks like. And so the patient would select, the level that they have of these different symptoms and then total it up at the bottom. And you can see, the different digestive, poor memory, the mouth and throat, coughing, all of those different, symptom groups and which ones they're having the most trouble with. Cause that can really, sometimes you get patients that are just lots of symptoms, and it helps you to be able to look at these scores and see, okay, your GI symptoms. I mean, we start in the gut a lot with functional medicine anyways, but if there's, overwhelming symptoms in one area or another, that can sort of tend to be the things that you work on first, as you're working through with the patient. So that's just a little bit about what we're doing. I can also show you our website and what status we have that at. So PharmToTable.life is our website. We can also go to PharmToTableteam.com and it will bring you right here as well. So we have done some work with story branding our website. If you've not read that book, it's one that we've as a team read and are working through how we make all of our marketing more clear. But you can see here, there's appointments for joining our orientation class as a transitional step. We also have the make an appointment button. We know that, $250 is a lot of money for someone to invest in an appointment, especially if they normally pay $10 to go to the doctor. So, we want them to learn about why functional medicine is different. And so we have an orientation class that we have multiple times, led by pharmacists on our team, myself. Right now we have 2 other pharmacists leading these classes. And so patients just can come over here, see what times the appointments are available. They can look, at different dates. So it looks like I have some people already booked in the different classes here. So they can book that. It gives them a little bit of information about that. And again, reminds them that they'll get their $25 back on their next visit. I really, a lot of people, there's a lot of information out there for free today. And so we've, sort of toyed around with offering different classes for free versus charging, and really feel that charging a small amount is the best thing to really make sure the patient's committed to coming and showing up for that information. So that is all there. And then, as far as what the team page looks like, so if someone wanted to click the book an appointment page, they would be taken to this page here, and they can also click, the state and see, who's in that state and who they can work with. And we also have a link there too. If we don't have their state on the team yet, they would be taken over to the marketplace. So here you can see, you can, click on one of the names. Sorry, the button there. And then this is, a little bit about Sarah and her, professional bio, also some personal information, and then, what her working hours are, the days that she's available for appointments. And so some people just put, because their time fluctuates, they have just, variables, see, the schedule. But it also links out to each of their profiles there as well. So if they were in a state that we don't have a pharmacist, then that's when they could click over to our PharmToTable network, and they could put their state in and see if we have someone in our network. So I will put in, let's see, what state do we have that is not Missouri? I am terrible about spelling. There we go. So you can see that Morgan is a pharmacist that is not on our team, but definitely a great collaborator. And she is listed here for appointments on the marketplace. But, we don't currently have our own team member in the state of Missouri. So that would be a good place, if you are not wanting to join the team, but you want to join the marketplace and have an account, we can definitely, we'd love to, whether we cover the United States with our team or whether we cover it with, our team and our external partners, we would love to be able to do that. So that is what we're looking like online. We're working on our marketing pieces, which I will talk about as we finish the presentation here. So let me get back to the slides. All right, so as far as the rest of this goes, again, one way to use the platform, like I mentioned, is just to join as your own provider, and then you can sign up by going to pharmatotable.azova.com. It should say, I'll make sure that link is clear in the email follow-up that you'll get. And you can just click sign up or onboarding at the top, and that will give you the ability to choose the clinician package. And the nice thing about this, even if you aren't part of our team, there's no monthly cost. And I'll talk a little bit about the structure of how those visits are paid, but basically you get a little bit of a fee comes out of each of the visits, and then that helps to pay for the overhead as far as the EHR and the telehealth technology. And then it's really flexible. So if you do, a couple visits a month, great. If you do, 10 visits a month, great. You don't have a huge, amount of overhead in the different systems. And so these are what on the network, whether you're on the team or using it as an individual on the marketplace. The payout for the new patient functional medicine visit is $185. The diabetes consultation is $110. The new patient med optimization visit is $110. Follow-ups are $110. So the $185, the patient pays $250 right now. The ones that your payouts are $110, the patient pays $150. And then the follow-up 30 minutes, I believe the patient pays $95. So we do build in, part of that comes to PharmToTable and the difference there, and part of it goes to Azova. So part of it goes to pay for, again, the platform on a as we're going basis. It helps us to be able to grow versus having to pay, $250 a month per provider, that providers aren't seeing enough patients to even cover that. So really this small amount as we grow is helpful. And then also, the overhead for PharmToTable helps, with our marketing and driving more patients to the website, which ultimately will help even the people on the just the marketplace, because of, if we don't have people covering those states, they would also go over to the marketplace from our website to find a provider. So so that's where that, comes into play. And then we also have group visits. And so the group visit for the patient is $25. So it depends on how many patients sign up for a group visit, what the payout would be to the clinician. And then the other way, which we would love you to consider, is joining our team. And so we are a team of pharmacists that are contracted with PharmToTable LLC. We have a community. We engage almost daily with each other. We have weekly touch points, that either I'm getting on, maybe we're doing a video conversation, maybe we're doing a group meeting on Zoom. We do monthly teach-ins. A lot of times in the summer we were doing twice a month, and now we're heavily focused in marketing, and so we're backing off a little bit, doing more like monthly teach-ins. And then the mentoring piece, there's experts on the team that we can reach out to. Like I said, I'm so excited about that ability to really have a peer-to-peer consult on the system where we can share easily with the other person we're consulting with the records for the patient, and having those easy to access consultations. And we can even bring in, once we have that, people from outside the team to be able to utilize there as well. So I almost think of it like, obviously we have to pay the people we're consulting with, especially outside the team. But I sort of think of it like a residency program. You get paid less, right, to be a resident. But if you're learning functional medicine and you want to reach out to this expert, you might have to pay them, $40 or something of your, and I'm just throwing that number out there. We haven't figured out pricing yet, but depending on how much time you're taking up, you're gonna have to pay a little bit of their time to have that conversation with you about the patient, and maybe you're gonna make a little less on your payout, but you are learning in that process and growing as a provider, and then might not need to reach out in the future to have those experts, depending on what the situation is. So I think it's going to be just a really great opportunity, again, where a lot of pharmacists are starting new at this and being able to grow together to just really pull in a lot of those experts in the field. And then training, we have a lot of training from our team shared, and then we have centralized supplement templates. I'm so excited. Next month, FullScript is going to be launching something I've been asking for a really long time, the ability to, save a template in there as far as a protocol and then share it with the team. And so that will be exciting. We also can share templates, like you saw, those macros that we're able to use in our assessment plan. Those are shared across the practice, so we're able to see those and build those with each other. So it's really takes, as we're lifting this rocket ship, right, to have more people underneath and more people, lifting and planning and working has been phenomenal. Because I think as I was dreaming this, for the last several years, thinking about how much I would have to do to get it to the point. I mean, I think in the last, 4 months, as we've had, 20 people working together doing this, we've, gone leaps and bounds so that I could focus on what I needed to focus on. And, some of the other team could pull, some other pieces. Some of the perks to being on the team: free access to the FX Med CE courses. And then also the onboarding fee covers your first year membership to FMPHA. And then you can have the option of saving sort of your FullScript sales money to put towards additional CE or training courses. And then the marketing piece. So if you think about how much marketing costs, I know how much marketing costs and how much right now is coming out of my account for our Facebook marketing team and even just the daily ads on Facebook. We really want to, try to centralize that so that, again, a little bit of money that's coming to PharmToTable from those visits are helping with that. But we're, marketing online because that's where our patients are, right, if we're clicking and scheduling an appointment online. But we're also helping to teach our team to how to market, developing brochures and business cards and lots of those things that people can just make a copy of and tailor it towards what they're doing, so that you don't have to start from scratch. So again, working together as a team to get there faster, but also I'm working to coach the team on how to have conversations with those partners, like other holistic health practitioners, maybe chiropractors, reflexologists, massage therapists, people like that have that patient population that we want already sitting in front of them, but then also our physician partners that maybe don't have the time to really do this as much as they might even want to. So finding those physicians that are open to those conversations about integrative practices, and working with them and their patients. So just a little comparison about, what it would cost to start up a business by yourself. So this would be, EHRs run anywhere from $125 to $250, depending on how busy your practice is. I know if you wanted all of the AZOVA, it's like $250 a month. On your own, the HIPAA compliant Zoom, is like $200 a month. So if your EHR doesn't support that, business insurance, for me is much more than $100, but for one provider, it might be $100 a month. FMPHA membership, for that first year. And then also, those courses, those CE courses cost money, and business coaching costs money, and to have that, support there. And then websites can cost a very wide range. Sometimes they're cheap if you have someone that helps you with that. Sometimes they're more expensive. And so it could cost you, at least $9,000, if not more, to really, get started in the first year. And so we want to make that cheaper. We want to make that ability for pharmacists to jump in to do functional medicine at a cost that makes sense to them. And so that's where our core team onboarding fee is $1,000. And if you're at the 6-month point doing 10 visits per month in the platform, there's no additional charge. If you do not complete 10 visits a month, then there is a technology fee. And the reason for that is to continue to do what we're doing, to continue to put money in marketing, continue to do the support for the team. We need to be able to have, at least an amount of revenue, anticipated for the month. And so that's where we will prorate depending on how many visits you do. So if you don't do any visits in a month, the technology fee would be $100. But if you did 5, it would only be $50. If you did 8, it would only be $20. So basically for every visit you do up to the 10, you get $10 off the $100 technology fee. So you do the 10 visits and we give 6 months, and our start date for even implementing that is June 1st of next year. And so if you join sometime in the fall of 2020, you'll get additional time there as well. And so if you're interested in being part of our team, head over to our website at pharmatotable.life and /join, and we will have the application there for you to be able to fill out. And then you and I will have a conversation about what it looks like. And actually, I'm going to start doing sort of group conversations about that, at least maybe once a month on our, on this platform. So anybody that's watched this video can jump on and ask questions, about the team and, joining the team. And we'll try to still do as many individual, quick appointments that we can as well to make sure it's a good fit. So I think that is what I wanted to, share with you today. So if you, have questions, feel free also to reach out to me. I'd love to talk to you. I know I've been hearing a lot from people all over the country, which is just awesome. I'm so excited. I think, another reason that I started this is, I feel like the Lord has put me through my health journey, not only to impact my patients. I see, the fruits of the struggles that, I experienced, and, the time where it was like, why, Lord, why is this happening to me? And, the prayer and all of those kinds of things, I've seen just like so much fruit of that as far as like patients getting better. And my friends' kids, actually one of them is actually one of the pharmacists on the team. Part of my journey was, introducing her to an integrative physician that changed, course trajectory of her son's life as well. And so I just think it's so cool to watch like how all of these things unfold and the influences. And so, as I'm dreaming about this team, I really feel like, I, as one person, can practice here in Ohio and influence, a small population of people. But with this team, we're able to spread that reach across the country and just really help people to get well and to thrive. And, that's what I'm, really passionate about. And so I want to help pharmacists, grow and learn more about this, because not everyone has had a health journey that they learned so much through. They might just have, watched someone else do that, or it might just be intriguing to them because they love nutrition, they love cooking, they understand the food as medicine concepts. They followed, Mark Hyman or people like that. And so, there may be various reasons for how you got to hearing about PharmToTable, and, what we're doing, but we really just want to be able to, do what we all, I've interviewed a lot of students coming into pharmacy school, and they say, they want to help people. And I think deep down, that's what a lot of us want to do. We want to, help people. We want to get them well. And unfortunately, in our current healthcare system, that's just not happening very often. And so we're hoping that, what we're doing here can be really a game changer, and not only for our patients, but maybe also for the profession as we, document what we're doing and move forward with other things. So thanks for your time today. I really appreciate you taking the time to watch this webinar and learn more about what we're doing. And I look forward to connecting with you in the future.